Hello and welcome to another review video. In this section I'll be talking about the blood system. For my students following along, this is from chapter 13 from your Language of Medicine textbook. This is going to focus on the blood system as it pertains to medical assisting. Let's jump in. So just a couple introductory statements. Blood is a liquid body tissue that transports foods, gases, and wastes to and from the cells of the body. Other things that are transported in blood, we think about chemical messengers, we call those hormones. We think about blood proteins, we think about white cells, and platelets. So the important things that need to go to and from places in your body are moved around primarily by your blood system. What's in our blood? Well, roughly 45% of our blood is cells. The other 55% we're going to call plasma. Of the cells, there's three different categories. We have erythrocytes, red cells, leukocytes, white cells, and thrombocytes, or platelets. Each have a different function, and we'll sort of get into those as we go forward. Blood plasma. Plasma is mostly water. In fact, over 90% of your plasma is water, with the other substances being wastes, like carbon dioxide, nutrients like glucose, salts like sodium, hormones, lipids, and vitamins. So about 45% of your blood by volume is cells, and again those are the erythrocytes, red cells, which transport nutrients and oxygen. They do that by having several hundred million hemoglobin molecules in every cell, and those hemoglobin molecules contain iron. Iron can bond to oxygen to form iron oxide, and you can carry oxygen around your body in that way. Leukocytes, or white cells, those are our, we think of white cells as our immune defense. We have 5 different types that we'll talk about. Thrombocytes, or platelets, form the clots around lacerations in our blood vessels. Either way, they keep us from bleeding out. So here's your leukocytes, your white cells. 5 different types. Basophils, those have heparin, which prevent clotting. Histamine, which is involved in allergic responses. Eosinophils are phagocytic cells involved in allergic responses and parasitic infections. Phagocytic cells, they eat things. They engulf and destroy either bacteria or cellular debris, whatever it is, they engulf and destroy the thing. Neutrophils are phagocytic, and they accumulate at the site of infection. Monocytes are phagocytic cells that become macrophages and digest bacteria and tissue debris, cellular debris. Lymphocytes control the immune response, and they make antibodies to the antigens from pathogens. Here's a pictographic review of what we just talked about. So you have your blood, and in your blood there are cells and there's plasma. Cells account for about 45% by volume, plasma accounts for the other 55%. In your cells, there are red cells, thrombocytes, clotting cells, and leukocytes, white cells. Leukocytes have 5 different categories: neutrophils, eosinophils, basophils, monocytes, and lymphocytes. In your plasma is largely water. Again, more than 90% of your plasma is water. There is salts, nutrients, hormones, and vitamins. On the other end of your spectrum in plasma, there are proteins. We think about proteins like clotting proteins, like fibrinogen and prothrombin. We think about globulins, like immunoglobulins, such as the antibodies that are carried around in our bloodstream for our immune defense. Plasma proteins, albumins, globulins for your immunoglobulins, your immune defense, fibrinogen, and prothrombin. Our blood types. We've all heard that we have different blood types. These types are differentiated by the presence of the antigen and or an antibody, or the lack of those things. Type A blood has the A antigen and the anti-B antibody. Type B blood has a B antigen and the anti-A antibody. So, type A blood given to a type B patient would cause an immune response because of the anti-A antibody in type B blood. And the opposite is true the other direction. There are universal donors and universal recipients as well. Type AB is a universal recipient. It has the antigens for both, but no antibodies, so it makes no response from any of the donated blood. Type O blood is no A or B antigen, but both antibodies. They can give blood to anyone, but they can only get their own blood. They can't get A or B or AB blood. The Rh factor indicates a positive or negative, and that's important in transfusions. Coagulation. Coagulation starts with this thing called a fibrin clot. So platelets we have an injured blood vessel. Platelets begin to aggregate in combination with tissue and protein clotting factors, calcium, vitamin K, prothrombin, and thrombin. That converts to become fibrinogen to convert to a fibrin clot. And then the wound is clotted and the bleeding stops. Anemia. Anemia is a deficiency in red cells or hemoglobin. Either way, we think a deficiency in the ability to carry oxygen around our body. 5 different types. There's a type not listed here called iron deficient anemia, which is the most common type, and that's simply just a deficiency in the levels of serum iron and the levels of iron in your body, usually due to dietary issues. These 5 pathologic types: aplastic anemia, failure of blood cells to produce failure of blood cell production due to aplasia, absence of growth or cell formation, in the bone marrow cells. Hemolytic anemia, reduction in red cells due to excessive destruction, hemolysis. Pernicious anemia, the lack of mature erythrocytes caused by inability to absorb B12 in the bloodstream. Sickle cell anemia, it's a hereditary disorder of abnormal hemoglobin producing sickle-shaped erythrocytes and hemolytic properties. The cells break apart. Lastly, thalassemia, an inherited defect in the ability to produce hemoglobin, leading to hypochromia. Hypochromia translated means undercolored, and because they're low in hemoglobin, meaning low in iron, they don't look as bright red, and so we think less colored than normal. Here's a pictographic representation of what we think red blood cells look like. We have, in the middle of this, we have normal red cells with their nice biconcave shape. The biconcave shape allows for plenty of surface area for interacting with the outside environment, so exchanging oxygen for exchanging gases, let's say. In the top left, you see spherocytosis. This is a hereditary disorder in which the blood cells are enlarged and are fragile. Because of the loss of concavity, there's less surface area, so less chance for interacting and exchanging gas. Pernicious anemia causes large immature megaloblasts, large red blood cells. Bottom right, sickle cell anemia creates crescent-shaped, distorted, and fragile cells. And thalassemia creates hemoglobin in low concentrations. Other diseases of red cells: hemochromatosis, excessive iron deposits throughout the body. Polycythemia vera, general increase in red blood cells. That's where the polycythemia word comes in. Hemophilia, excessive bleeding caused by hereditary lack of factors 8 and 9 necessary for blood clotting. Patients often bleed into weight-bearing joints like the ankles and knees. Purpura, multiple pinpoint hemorrhages and accumulation of blood under the skin. Leukemia is a cancerous process in our white cells, and there's 4 different types. You can broadly categorize these by acute versus chronic and where they occur, either myeloid, affecting bone marrow, or lymphoid, affecting lymphatic cells. The most common type in children is ALL, acute lymphoid leukemia. Other diseases of white blood cells. Granulocytosis. It's an abnormal increase in granulocytes in the blood. Mononucleosis is an infectious disease marked by increased numbers of mononuclear leukocytes and enlarged cervical lymph nodes. Remember, monocytes are involved in infectious response, and these guys become affected by a virus called the Epstein-Barr virus, and it causes them to do things like swell and makes the patient feel very ill. It's characterized by splenomegaly, enlargement of cervical lymph nodes, and general viral syndrome. Multiple myeloma, malignant neoplasm of the bone marrow. Malignant cells, lymphocytes, called plasma cells that produce antibodies, destroy bone tissue and cause overproduction of immunoglobulins like the Bence-Jones protein. Lastly, some clinical procedures. Apheresis, the separation of blood into component parts, and removal of a select part from the blood. Pheresis is the separation of blood. Blood transfusions, whole blood or cells taken from a donor and given infused into a patient. Bone marrow biopsies, microscopic examination of a core of bone marrow removed with a needle. Biopsy is taking any tissue from the body, or removing any tissue sample from the body. Hematopoietic stem cell transplantation, peripheral stem cells from a compatible donor administered into a recipient. Thank you. That'll be the end of my quick little review of the blood system. Please check back next time for more videos.